It's a privilege for me to be able to speak to this group of tourism professionals. I'm working at CIWEC Hospital and taking care of sick travelers as well as providing advice to healthy travelers for the past 32 years. The Himalayas in Nepal attract thousands of travelers each year. Now, in the year 2025, 1.1 million travelers visited Nepal, and about 25% of them were expected to go trekking. The Himalayan reality, it's a stunning, visually stunning environment, but physically demanding. There's a lot of up and down that you have to do, and you also have to face high altitude in a lot of the areas. High altitude tourism is increasing because of the number of travelers that have increased, to Nepal, and also that there are roads now to different high altitude destinations, particularly in the Annapurna region, that takes travelers to altitudes as high as 3,800 meters or even up to 4,000 meters without people realizing that they have really traveled to high altitude. They go on motorbikes, they go on jeeps, and are exposed to high altitude areas very quickly. And with that, the safety responsibility is growing. Now, this impacts the safety of the traveler, the reputation of the destination, and also this will eventually impact the financial side of things. What happens at high altitude? A lot of people probably know about this, but just a little bit. To put things in context, there is less atmospheric pressure at high altitude. That leads to less oxygen being available to the body, resulting in a state of hypoxia. And our body adapts to this by a process called acclimatization. And this is essentially done by increasing the rate and depth of breathing, and also by increasing in the heart rate. And so normally, one is able to adapt and you don't really get any symptoms. You are able to trek safely, you are able to climb mountains safely. Now, if there is rapid ascent without giving time to acclimatize, then it stresses your system and you have symptoms of acute mountain illness. Now, the most common form is the acute mountain sickness. About 50% of trekkers to the Everest area will have some form of MS. But that doesn't mean that they have to, come down or they have to terminate their trip. They're able to stay on, get over their symptoms, and then get going. So the earliest symptoms of MS are headache, dizziness, fatigue, and not having good appetite, like a bad hangover. That's how we remember it. And the severe symptoms will lead to fluid accumulation in the brain, called high altitude cerebral edema, with symptoms such as mental confusion, unsteadiness of gait, or fluid buildup in the lungs, a condition called high altitude pulmonary edema, where someone gets short of breath and has extreme fatigue. So these two conditions, haze and HAPE, are severe conditions that necessitate quickly coming down to lower altitudes. This slide is moving. All right. There is genetic susceptibility to altitude illness. In a group like number of people like this, there could be maybe 10 or 15 people who are susceptible to altitude illness, but others will be fine. So there is a genetic susceptibility to altitude, but we cannot change our genetics. So what we can change is the rate of ascent. So rapid ascent will lead to symptoms. That's the biggest risk factor. And being fit doesn't really protect you from altitude. A fit person can get sicker just as well as a person who's not so fit. And anyone can be affected. Anyone who's old, or young, or male or female can be affected. So the biggest risk factor that we can do something about is the rate of ascent. Now, high altitude helicopter evacuations, a little bit about how it started. Back in the 1980s, Nepal Army used to do the helicopter rescues if there were sick travelers stranded on the mountains. And from the 90s onwards, private helicopter companies came into being. When I was a doctor working at the Himalayan Rescue Association aid post in Ferriche in 1999, we had a few private companies, but most of the rescues were still done by Nepal Army. Communication was difficult at that time. There used to be radio communication, maybe just a few hours a day. But gradually, the private helicopter companies have increased in number. There are now 12 helicopter companies registered. And, a lot of them go up the mountains for sightseeing purposes. And a lot of the Nepalis also use to come back for medical care to Kathmandu. And it's used a lot by the travelers who are stranded in the mountains because of illness. And so we've had increased helicopter evacuations over the years. Now, many are absolutely necessary for life-saving. And, our pilots put their lives at risk to bring people from as high as Camp 2 on Everest, from Everest Base Camp, and other difficult terrain. So they are absolutely necessary and life-saving. But some of these, could have been prevented if we had done earlier interventions. For example, if the traveler was properly acclimatized, and if the traveler was advised timely descent when he or she continued with symptoms, and also if it was an informed decision between the traveler and the company. So we feel that it's, decision-making in the field is really a shared responsibility between the traveler, the guide, the company, and also maybe the insurance company involved. And evacuation should always remain a last resort, not the first response. But every decision should really prioritize the health and safety of the traveler. There are deaths on the mountains every year. There are about 15 deaths per 100,000 travelers. The research that we did 7 years ago. So rather than focusing on what goes wrong, I think it's more important to ask, what does safe and responsible trekking actually look like? So we should have, proper acclimatization schedule, gradual ascent profile, and built-in rest days. We say that, after every 1,000 meters, there should be an extra day of rest. And we also recommend that there should be some extra days for the traveler in case he or she doesn't feel so well. And, 95% of helicopter rescues occur in group travel. That's because there's the psychology of the group. They don't want to leave someone behind. And also that the traveler feels, why am I the only one with symptoms? So a lot of this really happens with group travel. And proper acclimatization, having rest days will really help to control this problem. So we also would like the traveler to be aware of acute mountain symptoms, and also they should have no pressure to continue. Sometimes people feel that they have to get there, and they keep pushing themselves to go on a horse to a higher altitude, which is really the wrong thing to do. Stopping early is not failure, it's really prevention. And, the guides, although, they should be trained in basic first aid and CPR and stuff, but they should also have the ability to identify early warning signs and be able to confidently say to the traveler, you should not go higher, you should really stay at the same altitude. Informed travelers would really be extremely helpful, to prevent this kind of situations. So they are to have pre-travel health briefings, possibly in their home country, if not, in Kathmandu, or in places that conduct these trainings on a regular basis, and then have realistic goals. They should not be able to do Everest Base Camp in 5 days. A well-informed traveler really makes safer decisions. Access to medical advice. Now, there is very good internet up in the Everest area and other areas. Everest area, of course, all the way up to Camp 2, they have Starlink internet and they can communicate very well. So remote consultation when needed, and with partnerships with qualified high altitude medical professionals, this is possible, so that people can make informed decisions. And clear evacuation protocols, define criteria for evacuation. Some things are very clear. Someone who's unconscious, someone who's had a heart attack, a severe chest pain, severe shortness of breath, someone with fractures, it's obvious that they need to come down. But it's really the gray areas where someone has acute mountain sickness and feels that maybe they need to come down quickly. So they can have if we have criteria for evacuation protocols, this would really be helpful in such situations. Ethical industry practices, safety over summit success, transparency in decision making would again be helpful as well. Ultimately, safe trekking is not about avoiding all risk. It's about managing risk wisely, consistently, and ethically. Thank you. These are the two CIWEC hospitals, one in Kathmandu, one in Pokhara. And thank you for giving me your ears. Have a good day.